Hello everyone. It's been a busy start to the year for the policy team here at the Royal College of Ophthalmologists. In this update, I wanted to share a couple of important influencing activities that we have been involved in, as well as a larger project that has finally come to fruition. So starting with the latter, we are really pleased to be able to support the launch of the UK Eye Care Data Hub, which we have launched with a number of other organisations from across the eye care sector. The tool is in two parts. So the first estimates the current multidisciplinary eye care workforce and how these numbers are likely to change based on current trends. And the other part of the hub contains prevalence data for lots and lots of eye care conditions, utilising the comprehensive database that we at the college have developed and will continue to evolve in the coming months. So we hope the data hub and our separate prevalence data is really useful for commissioners across the UK as they plan their eye care services. In terms of other influencing activity, we responded to NHS England's annual planning guidance. We welcomed their focus on giving local systems more control over financial spend, which is something we've long argued for. We pointed to the fact that in ophthalmology, spending on cataract services has hugely increased, particularly because of rising independent sector activity, while funding for services that support clinically higher risk patients, such as complex glaucoma or wet AMD, have been insufficient. So a rebalancing of this activity to ensure best use of limited resources and that we do more to prevent irreversible sight loss is essential. In a similar vein, we responded to NHS England's elective reform plan. We welcomed their focus on tackling backlogs, but we stressed that follow-up appointments need to be a priority, not just those patients waiting for a first appointment with a consultant. Away from England, we raised concerns about the stalled rollout of electronic patient records in Wales. We wrote to the Welsh Government to emphasise the importance of resolving this issue to enable more efficient integrated eye care services and also implementation of the National Clinical Strategy for Ophthalmology. Their response did stress that the college would be involved in future discussions about the rollout, which is positive. So hopefully there will be further news to share on that shortly. And finally, we have done some work around artificial intelligence in ophthalmology in January. We published an article in Open Access Government, which reflected many of the points that we have been articulating since our 2024 position statement on this. We outlined that AI tools should be adopted via an iterative process in ophthalmology, with services conducting regular audits, quality assurance, and inclusive patient engagement to ensure safe and effective implementation. So that's a brief overview of some of the activity we've been doing in the policy team in January. Do head to the news section of our website to see more detail on all of those issues. And thank you for listening.